So Andarki Namaskaram. Now we are going to discuss about gout. So what is gout is nothing but you have this gout topic in biochemistry, as well as you have this topic in pathology, as well as in pharmacology also. So we'll just integrate all these things and we'll just give an overall brief idea about the gout, right? So let's start. So gout is nothing but we have, it is uric acid accumulation in the joints. So uric acid accumulation in the joints is called as gout. In a broad way, how to define it is uric acid accumulation, right? So this uric acid accumulation, it occurs in joints, right? So what is the most common joint that is affected? It is first metacarpo metatarsophlangeal metatarsophlangeal joint, phalangeal. So you all know that when you saw the first metatarsal joint, that is there will be swelling, very much swelling, and it will be unbearable pain, right? So that characteristically the gout presentation that we have, and the uric acid crystals that we have are monosodium urate crystals. So these are monosodium urate crystals that we have, right? And then we have, these are negatively birefringent. So this gout may be either primary or secondary according to the pathogenesis. So they may be either primary or secondary. Primary may be either congenital defect, like we have HGPRT, we have HGPRT enzyme deficiency, which characteristically presents as Lesch-Nyhan syndrome, right? So it presents as Lesch-Nyhan syndrome. Or secondary gout, maybe you all know, either it may be increased protein diet that you will take, right? So many causes will be there in secondary, that will be discussing the pathology or pathological aspects in detail. If you want to just comment it, then I'll discuss regarding that also. So here this completes about the pathogenesis briefly. What happens is, this monosodium urate crystals are being taken up by the macrophages, and these macrophages, they release the interleukin 1 and forms the inflammasome, right? And it causes the pyroptosis, right? So this pyroptosis occurs in case of this gout, right? So this is what happens here. So we have now we go with the pharmacological aspect, how to treat the gout, right? So we all know that is acute gout as well as chronic gout, right? So these are the two types of gouts that we have and how to treat them. These all are very important topic with respect to the pharmacology as well, right? So we have this, first we have the cell, right? So this is the cell that we have, and this is the DNA, this is the cell, and this cell has an important feature that we have the DNA in the cell, and this DNA has purines, right? So these purines are being converted into uric acid. Where it happens is with respect to the enzyme involved is xanthine oxidase, and this xanthine oxidase is present where? It is present in the liver. Sorry, it's actually not exactly looking like a liver, but yeah, I'll definitely make it look like a liver for you. Yeah, just adjust with it. So this xanthine oxidase enzyme present in the liver, it converts this purines or the hypoxanthine more specifically into the uric acid, right? Now this uric acid, it enters the tubules that we have, right? So this is the tubule that we have, and here the uric acid is being entering into the kidneys, right? So before that, we can convert this uric acid into allantoin. So this allantoin is a highly lipid soluble or highly water soluble, highly soluble substance actually. So this can be eliminated in the urine easily. So for this we have an enzyme, that is a uric acid oxidase enzyme, right? So this is what we have. Then either after entering into the kidneys, this is the glomerulus that we have, and this is the loop of Henle and all those things, and this is the DCT and collecting duct. Here we have a transporter, that is OATP transporter. So what is this OATP full form? I'll write here, that is OATP, organic anion transport protein, right? So this is what we have with OATP. So we have the drugs which inhibit all these steps. We have the drugs which are inhibiting these steps. We'll discuss about it now in detail, right? So the drugs which are inhibiting this xanthine oxidase are allopurinol and also febuxostat. So what happens here is the allopurinol that we have here. So this allopurinol is competitive inhibitor, whereas febuxostat is its non-competitive inhibitor. Right? That we need to remember here. That's the first point. This uric acid oxidase enzyme, recombinantly we have pegloticase as well as rasburicase. Right, so these are the two things that we have with respect to uric acid oxidase, and we have OATP, this transporter which enhances the uric acid excretion. We have that drugs targeting this OATP transporter also. So what are the drugs we have is, we have probenecid. So we need to discuss about these drugs. Yeah, allopurinol, you all very well familiar about it. That is, allopurinol is xanthine oxidase inhibitor. With respect to allopurinol, I want to discuss one more point here. We have azathioprine, or you have 6-mercaptopurine, right? So these two drugs are anti-cancers which are eliminated by xanthine oxidase enzyme. So since we are using allopurinol, can we use the same dose of azathioprine or 6-mercaptopurine? No, because the xanthine oxidase enzyme which is metabolizing this 6-mercaptopurine or azathioprine is now inhibited by this allopurinol. Thereby, it may increase the toxicity of azathioprine or 6-mercaptopurine. So, we need to reduce the dose of this azathioprine or 6-mercaptopurine when we are using along with allopurinol, right? So, this is the entire thing about this. And then we have in acute gout, we'll go with first NSAIDs, except aspirin or paracetamol. Then we have if it is not working with this NSAIDs for pain relief, then we'll go with colchicine. So this colchicine is nothing but we have a very much important drug that we need to discuss, right? So yeah, we have colchicine, which is a microtubule inhibitor. So it is useful in the acute gout mostly, and it is safe in the renal failure. And how it acts is nothing but this colchicine which we have, it just inhibits the WBC movement, that is chemotactic movements of WBC, and it also helpful in the, that is it inhibits the inflammatory mediator release. It inhibits the inflammatory mediators to cause inflammation. In chronic gout, we have these things, that is allopurinol, febuxostat, probenecid, and also we have pegloticase and rasburicase. So these are the things that we'll use, and this rasburicase which we have, we can use this rasburicase to tumor lysis syndrome also. So this is a short topic that we have, the gout, which is very much important with respect to a 5 marks question in university exams. And also we have important MCQs here, like this 6-mercaptopurine, and we have this actually pegloticase is a NEET PG 2025 question. You all know that it's a NEET PG 2025 question. See the pegloticase, what is the mechanism of action of pegloticase? is nothing but the uric acid oxidase. So it converts the uric acid into more soluble or highly soluble form, that is allantoin, right? So this is all about the uric acid, increased uric acid, that is gout, right? So what is the main important thing about gout is increased uric acid production, or there is accumulation of uric acid in the joints, especially in the first metatarsophalangeal joint. And also we have this macrophages and all those things.